Good afternoon. I'm so grateful to be right after lunch because everybody's feeling great and relaxing. That was really delicious. Really a privilege to be here today. I'll briefly introduce myself and then hand it over to our panelists to introduce themselves. Just wondering, can I get a quick sound check? Can you guys hear me at the back of the room okay? Thumbs up? All right, awesome. My name's Brendan. I'm a proud resident of London. I grow some food at home. I grow a lot of native plants. I'm known for work on birds, and like birds, I also distribute seeds. So if you want some free seeds for your garden, come visit me at a booth outside. I have been involved with organizing this event and really care about the future of our food systems in the context of climate change planning. There's so much love in this room for food. In my house growing up, I was told that there's two types of people. There's folks that eat to live and people who live to eat. And I would say I live to eat. I love food, and I'm so thrilled to be here with you all today. So I'm going to hand it down to our panelists to just introduce themselves one by one. And remember to please speak into the microphone.
Hi everyone, I'm Michelle Strangis. I'm a specialist for the Quality Transformation Innovation Team at St. Joseph's Healthcare London. And I've started on this journey. We have an on-site garden now, which we're in our 4th year on the Parkwood Institute campus. And it started with our work with a national organization called Nourish Leadership. And they help kind of harness the power of food for health for the people and planet. So we've been on this journey with them to just improve the food in healthcare for our patients, and they are really passionate, and it has been passed down to us too on having culturally mindful foods, sustainable foods, and local foods. So that's been a lot of the work we've been doing. Our garden is about 9,000 square feet. It has 8 blocks. There's 4 planter boxes. And we grow a lot of vegetables, and the food from the garden goes straight from the garden to the patient trays. So we're really excited about the work we've been doing, and we've also partnered with our therapeutic recreation team who bring the patients down to the garden to use as part of their therapy. And we also have partnerships with their Indigenous partners where we're growing some traditional medicines, and this year we started the 3 Sisters. So that's kind of why I'm here today, and I'll pass it along.
Thanks, Michelle. I'm Chantel Crockett. I guess first and foremost, I'm a mom to the 16-day-old baby down there, if you saw her at lunch. So I apologize if she starts cheering us on during the panel. But with that, I am a local counselor in Thames Centre, which is just east of here, representing a predominantly rural ward. This would be my first term, started back in 2022. Through that, we've established community gardens in both of our urban centers, so being Dorchester and Thorndale, and the produce is used by our local food bank as well as our active living center, and we use it as an educational space as well. Second, I guess that'd be third to that, I am the Strategic Partnerships Manager at Agricultural Adaptation Council, which is essentially a third-party delivery provider for government funding, but we represent, our membership base represents everyone kind of across the supply chain, from retail to livestock, various commodity groups, and ag organizations. So yeah, we're looking forward to discussing a plethora of questions this afternoon. So here you go.
Thank you. My name is Patrick Dunham. I own Patrick's Beans here in London. It's been going for 11 years now. Sourcing mainly from Guatemala, a cooperative that I've been working with for about 20 years. Incredible group of people down there. Before that, my whole life has been in food. I started cooking to get out of chores when I was about 13. And we had a family farm that we grew up with, and the whole family getting together and processing, freezing, preserving, growing, working. It was a great childhood. And I'm glad to say right now that my kids get to do the same thing at New Moon Community Homestead, so they get the same experience that I did for their teenage years and getting used to another kind of community that we found here. Coffee is just another kind of food, and that's my viewpoint on it. And I specifically work with small other local businesses that are either startups, to do their own cafes, restaurants, catering jobs, local fundraising, and that kind of thing to help network and help everybody get a little bit stronger.
Awesome. Thank you for those introductions. So we're going to dive right into it. And we've got our first question from Michelle. How has the Parkwood Institute Garden initiative changed how your institution thinks about food, wellness, and community connection?
Thank you. So one thing that the garden has really changed our, the thoughts in our organization around is the connections and partnerships we can have within the community that we didn't previously exist, especially in food services. So to support the garden, we've actually partnered with our friends here at Urban Roots London, and they are the experts behind the work that we're doing. We don't have a gardener in as a job description in the hospital, and we don't have the in-house expertise to be able to run what's involved in an on-site garden. So they support a lot with the managing of it, the crop planning, the crop rotation, the soil quality, getting our seeds and our seedlings together. They also help with their training. So we have 2 Canada Summer Job students that work in the summer. So when Ben was saying earlier about those shoulder seasons, that not having the support, we feel that now. So we've really learned a lot from them about the importance and also the amount of work that goes into farming or gardening that I think is very underappreciated. And now that we're kind of in it for our 4th year now, we're just like, okay, this is a lot of work, but it's really great. Been really passionate about it. Also and with our partnership with them, it's also led to a lot of other community connections. So we've had some of the university classes come to the garden, learn about what we're doing, and volunteer there, as well as the Thames Valley District School Board. They have their HELP program, which is an environmental group that will come, and they've helped with either closing off the garden or starting it up in the beginning of the year. So a lot of those partnerships we didn't typically have beforehand to support this work and really have this really unique community connection right on our campus. And then also the garden itself, when we started this Nourish project work, it was put on our strategic plan starting in 2021. So that really helped elevate the importance of the work that we're doing. And at the time, the strategic plan was reaching out to the community. So the work we were doing really centered around that. And with that, we had a steering committee. So that steering committee, especially for myself, was in meetings with some of the VPs that are very supportive of the work, directors, we had frontline staff. And through a lot of those collaborations, that's where someone was like, hey, can patients use this as part of therapy? And that was the director at the time connected me with one of the therapeutic rec specialists. And since then, we've been connecting on how do we make this work? What processes do we need in place? When are they going out? What are the resources and tools that they need in the garden? So beforehand, between even departments in the hospital, we didn't really have a lot of those connections to really work together to strive for something we find is really important. And patients have been coming out as part of their therapy and really enjoying it. And I remember being out there one time with, while some patients were out there, and they were just like, thank you for letting us come out here. They appreciate being out in the outdoor space. And even though we're along Wellington Road, they find the space really calming. So that really just helps emphasize the work we're doing. And also with having a steering committee, it's also connected us with more of our Indigenous partners through Big Con, which is through Atlosa. And same thing, we just reached out to them and started building a lot more of the connections and met with them in the garden, asking them what space do they want to use and what do they want to grow and how can we support them in order to grow the medicines. And then this year we started growing the Three Sisters. So that's been a really unique experience in learning about how they're grown, the planting practices. I know that Ben and some of our other partners have been chatting about some of the different ways that you can grow the Three Sisters because there is a few different ways and how that can really strengthen some of those community connections and about providing the food for our Indigenous partners. And so I think the garden has really just reinforced the importance of food and wellness, and being able to make those connections with. We also have some staff that come out and volunteer in the garden space, and they bring their kids to the garden. So they're using it as part of their volunteer hours, but they're also getting that education and experience from it. And then from having staff there, we've also had our CEO out, and he's supporting the work, and he's come out a couple of times to the garden. And most recently, last fall, we had the former Minister of Agriculture. So it's really, a lot of the work has expanded, and it's supported at all levels of the organization, which has been really great.
Thanks. It is a really beautiful space worth checking out. My next question is for Patrick. What challenges and successes have you experienced running a local food business in London?
I would say I was really, really lucky when I started my business. I've been in London mainly on, a little bit off since I was in my early 20s. So I have a really, really strong network and a really strong community in London. So when I needed to start Patrick's Beans, and I needed to start it quickly at the time, I already had a lot of infrastructure in place that a lot of other people don't have when they start a business or start a project, especially for a food business, because there's so many options out there right now for food. Small restaurants, small cafes, food trucks. There's so many different places that we can go nowadays, which is fantastic. I really appreciate the diversity. So that was a piece of luck that I had for struggles and difficulties. It's the same as running any business. Labor, which I've been lucky that too. But it's mainly been working with my customers. That's the main thing that I do, is work with my wholesale customers to help them grow their businesses. So all the experience that I have over my kitchen career, my catering career, working with a city, getting through loopholes, dealing with the Board of Health, that's all things that I pass on to my customers, so that the lessons that I learned, I can help them with. And I find that that's the biggest challenge for small scale startup businesses in London, is navigating bylaws, navigating the city requirements, navigating all those sudden surprising costs that can jump up and sort of hijack and put a pause on something opening up. Because the small organizations and companies and entrepreneurs that I work with, they need to start their businesses within a timeline. They only have so much capital. Their banks are on their backs. Everybody needs them to get started, and they need to get started too. And if they get a 2-week slowdown, or if they have to go back and redo a permit, if they have to tear out something, it can really be a hindrance on them getting their project going and potentially derail their entire operation. And more than that, I find for my startup customers, and there's an incredible business opening up in Byron in a couple of weeks. They're going through the permit process and inspections right now. I'm crossing my fingers for them that there isn't going to be any hurdles, and they're going to bring a lot to that community. So that's the biggest challenge I find, parallel to just running my business, which is pretty straightforward, is helping my customers grow and succeed, and help them to navigate through, whether it's city bylaws, whether it's permitting, whether it's even local suppliers. So create that network where everybody can be a little bit stronger and everybody can rely on each other and build each other up. Because it's not just, if one of my customers is purchasing from me, purchasing from another local business, purchasing from another local business, that helps the entire local economy, instead of going to, and I know this happens a lot because it's cheap, which is unfortunate, but Costco is now the simplest and easiest and tends to be the cheapest place to get stuff. And it's unfortunate, but I understand it from the the cafe or the restaurant's perspective, because they have a bottom line too. So it's figuring out a way to break that Costco addiction, but it makes total sense to me because I've been there myself, and try to figure out other ways where we can hook up local suppliers more easily, more readily for everybody to purchase from as a business in London.
Thank you. And I now have a question for you, Chantel. From your perspective as somebody working in local government and with the Agricultural Adaptation Council, what policy shifts do you think would be most supportive of our regional food resilience?
Thank you, Brendan. So, two-part question, two-part answer. So from a local government perspective, I think it's really important that municipalities and counties embed agriculture and food into their official plans. If this can be by way of preserving productive farmland, zoning or bylaw flexibility for uses like processing, storage, on-farm retail. In Thames Centre, one of the aspects that we focused on when we were building out our strategic plan for 2024 to 2027 was embedding farm gate sales and other agri-food components into our strategic plan under the economic development aspect of it. So having that ECDEV pillar as a lower tier municipality allows us to not only utilize our local resources, but also helps us align with, say, Middlesex County or neighboring City of London in alignment of kind of how we can all work together regionally. And I think another aspect that's really important is looking at your settlement boundaries. You want to treat land, especially agriculture land, not just as land itself, but as a critical infrastructure piece. And I think that would really assist in kind of the regional food security for our area. In regards to kind of the more agriculture sector perspective, resilience really comes from a united, collaborative voice. Commodity groups, ag organizations, I know there's some OFA reps here, really need to align on priorities and have an understanding that just because that there's large commodity groups, there's also smaller ones. And most of the time, there is more effective cross-sector funding at provincial and federal levels if you advocate together. The support for shared needs benefits kind of the entirety of the supply chain, and with that brings strong policy with planning, the advocacy side of things to government, whether that be local, provincial, or federal. I think it's really important to just kind of have a cohesive voice, and that really allows you to kind of build out that strong foundation for a local and secure food system.
Great, thoughtful answers. I'm going to pass it back to Patrick now with another question. Based on your experience, how do you think we can incentivize businesses, whether they be institutions, large or small businesses, to source and process food more locally?
In my experience, specifically with coffee, I've interacted with a lot of different organizations across the city and across southwestern Ontario. For the larger institutions, I think, especially ones that are funded or run by different levels of government, whether it's municipal, provincial, or federal, I think that there should be a little bit more thought put into procurement. And I understand that you need companies like Aramark or those large food service companies that have the infrastructure, that have the training and the labor to help run some of these cafeterias, some of these food courts, and some of these, like even at the top of City Hall, is an example. None of those, like Aramark being a multinational corporation, they don't have anybody in Middlesex County that will understand what we can supply to them. They'll just go to the Cisco's and the ginormous companies and purchase, whatever the hell it is. Excuse me. I have teenagers, they're corrupting my voice. And they just take the easy way out. You know, I think as, especially as something run by the public and on the government side, if there is an understanding, I don't like the word mandate or anything like that, but a goal to bring in 10, 15, 20% locally sourced and produce goods at each one of those locations, that could be a really strong way to support the local agricultural and food economy. And, you know, farmers, they want to farm, so they can't necessarily get in there and showcase things. But there's ways to advertise where the food comes from to get it into those places and organizations, and that's public money going in there. And even if it is slightly more expensive, that public money is helping support the local economy anyway, which is good in the long run. So I think that's a, you know, pretty straightforward and easy way to do it. And on the local side, helping and making it easier for people to take businesses out of their homes and their passion projects and to allow it to start to work and function. Again, with the Board of Health, I understand the need for those rules, but there has to be an understanding that if somebody has this great idea, they need to start it somewhere, and that tends to be in their household kitchen, then to a market, or then to a craft sale. And it is very scary for some people to take that risk because they don't want to make people sick, or they get told you can't do this, it's been made at home. All the hurdles that can come up in that kind of organization or that kind of process. So, you know, I think a way to allow that idea, and, you know, the person that I just mentioned who's opening up in Byron, that was a COVID project that has exploded so well. I'm absolutely impressed what they've done in a year and a half. And it started through the same thing, and now they're employing many people and doing incredible work, and just a great organization that started in a kitchen. And that's the kind of entrepreneurship that we need to support.
Thank you. Question for Chantel, and I love this question as a vegetarian, something I think about a lot. To support local procurement, what work is being done or should be done to strengthen production of key local foods, from fruits and vegetables to grains and protein sources like meat, pulses, and legumes?
Thanks, Brendan. And I apologize that I made Kathy add meat protein to the question because it wasn't there at the beginning. And I'm not a vegetarian, but I respect your choice. So I think looking at strengthening local procurement really starts with connecting producers and growers with consumers, retail, and other institutions. I think a really important aspect of that, which, you know, everything costs money, but what should not be shied away from is the communications and promotions that you can get at various levels of government. I saw a few Foodland Ontario items out in the hallway. Foodland Ontario, in my prior world, I worked in dairy for a long time, and they did such a good job at bringing commodity groups together on a monthly basis to kind of share resources and ideas with each other to kind of see how we can not only promote in-season foods, but also to utilize dollars in the marketing world to kind of partner in cross-sector opportunities. And I think that with Foodland Ontario, it's such a unique piece that we get to all work together on a provincial level and really kind of assist everyone kind of working together, whether you're large or small. More on a local aspect, I know that Middlesex County has the Savor the Season or other local promotions that they do to kind of highlight some businesses in the area. Oxford County has the Cheese Trail. Thames Centre, we do a Support Local campaign in October. One of the business that we keep chatting about was on our Support Local campaign last year when they first opened. So I think bringing that awareness, the promotion aspect, and really the pride to what's available is really important. At the same time, we also need to support producers. if that's investing in processing and distribution, kind of helping to diversify and scale. Obviously, the location we're in today at the Grove is a great component of that. Access to capital and land will always be a barrier, and I think that there could be a lot more done in that perspective, just to ensure that food is available and can meet the local demand that's there. Because I think that there is more of a local movement than a lot of people realize. And I do, there's fortunate things that came out of COVID, and some of that being kind of this local food movement and seeing what alternative options are out there. And then I think there just needs to be kind of an overall understanding for those that maybe are kind of new to that space, is that local procurement will vary by availability, by season. It may come at a higher price point, but funding, partnerships, and other supports will ultimately pay off in the end. And then I think that there is still and going to be continuously kind of a public education component, understanding what is available, where to find items, and when. And I think, as Patrick mentioned, kind of building that network and utilizing those network connections to kind of see what's out there. I don't think anyone needs to start from scratch in this day and age. So there's a lot going on there. And if you were the one that wanted to chat about peanuts, we can talk about that after.
Yeah. I eat a lot of peanut butter. I've been advised we have just under 10 minutes and I got 2 questions left. So I'm going to ask a couple questions and hopefully we can get through them. This question is for Michelle. What lessons from the Parkwood Institute Garden could help other organizations or institutions increase local food procurement and strengthen community connections?
Okay, I'll try to be quick, but we've learned a lot of lessons. But the probably main one is that, being a hospital, we can't grow everything, and especially with a seasonal garden. We can't grow it all. We serve about 1,000 patients and residents a day, so our garden can't supply enough for that. So we also need to align what we're growing with what's on our menu. So some lessons and things that other institutions can learn from is making sure that you start small, do some easy changes to start with. So something like cherry tomatoes. We have beautiful heirloom cherry tomatoes. I learned a lot about them recently, or over the last few years. And having like the beefsteak tomatoes, those are things we already serve on our menu. So it's an easy kind of swap onto the patient tray. Same with like the tomatoes we're slicing, we already have processes in place to do that. But then when it comes to, trying to grow something like carrots, that's where the processing piece comes in, and there's a lot more processing that needs to happen from, we typically buy our carrots already pre-washed, pre-chopped, they're just ready to go and just dump them in a pan. But now they are coming from the garden full of dirt, and we need to now scrub them, wash them, and then chop them. So we have a food processor, but where a lot of the pain points are coming from is the amount of time it takes to actually wash the carrots. So we still have more carrots to come out of the garden, which I'm a little bit scared to tell our staff about, but there's a lot to learn from there. But then there's also been a lot of exciting things of just trying new things. So something like bok choy, there's a lot of hesitation to put that on our menu. We've never served bok choy before, and we put it on the menu, and patients really noticed they noticed like, oh, this is something new. They're excited, they loved it. So we need a lot more bok choy on it for next year, Ben. Thank you. And then the other big thing is just promoting the work that we do. So we make sure that we try to put promoting it on the tray ticket, so when patients are getting their meal trays, they can see that it's, garden tomatoes or garden carrots or whatever it may be. We have posters. Any other of the local food that we purchase, we also have posters up saying, your asparagus is from this farm today. And it's really nice for the patients to see that we are focusing, it's a priority for us. And also for the staff too, they enjoy seeing it. They're like, oh, I also buy my asparagus from there when it's in season. So it's building some of those connections for promoting it, and then also reporting it. By reporting it up, we have all this great support food is on the map, and typically food in healthcare is not really talked about. It's usually, the typical like Jell-O scenario, but I'd like to say we don't have that much Jell-O on our menu. So it's really, we're kind of more on the map about it. We're reporting it, and we're building other connections out because it's going, to the, the board reports, and there's, the foundation that donated our irrigation system and things like that. So there's a lot of benefits in us being able to promote it and then also report it as well.
All right, in our last 5 minutes, we're going to do a quick lightning round question. Is there a policy at the municipal or provincial level of government that you believe could most effectively strengthen food systems in our region? And that's for all three of you. Who wants to go first?
I'll go first.
All right.
I'll be quick. I think one of the best things that could help grow new businesses in Middlesex County and London is to do a business mentorship program where every business has different hurdles and new struggles and challenges as the business grows. No big multinational has succeeded on their own. So if somebody already has the experience, and as you said, we don't have to start from scratch. That shouldn't need to happen anymore. And it doesn't have to be in the same category of business. Everybody deals with the Canadian Revenue Agency, everybody deals with labor issues, everybody deals with shipping. If there could be a way to connect one-on-one and not just in a conference setting, but one-on-one to really help answer those questions and to help those small businesses get over the hurdles to become bigger businesses, I think that would be an incredible way to grow food policy and to grow the local economy as well.
Who's next?
Okay, we'll go down the table. I'm going to very quickly say two things, because one, I want to just reiterate that land use planning is foundational, and the PPS struggles with that on a local level, and we just don't want to see productive lands lost to housing sprawl. On the same lines as Patrick, I think cross-ministry collaboration is critical. Ag and food does not exist in a silo. Progress depends on coordinated policies, labor, environment, transportation, finance. They can all address the interconnectedness of the ag and food sector, and I think that that's going to be integral going forward.
And from a healthcare institution perspective, I think a mandate on buying a certain percentage local, so we have our own internally, but for others to have a bit more of a mandate or policy in place to encourage people to buy more local, I think that would be helpful. And then more policy around health promotion and prevention to help with those that are experiencing food insecurity. If they're leaving the hospital, we don't know if they're going to a food secure home. So if they're not eating well, they're not nourishing their bodies well enough, and then they're coming back to the hospital sooner. So how can we kind of build those bridges between the hospital for food initiatives, so when the patients transition back, they are also supported?
All right, all really great ideas, and I want to take a moment to thank our panelists for sharing your perspectives and knowledge with us today. That brings us to the end of this panel, and I want to thank the audience for your attention and looking forward to the workshop. As a reminder, in the hallway, if you have an answer for the final question about policies you'd like to see, write it on a Post-it and plaster it outside. We'd love to hear your ideas too. All right, thanks.